All right, good evening and welcome to the regular City Council meeting on April 9th, 2020. This meeting is being held remote in accordance with the Chapter 40A of Massachusetts General Law and Governor Baker's emergency order on March 12th. In accordance with the Governor's order suspending certain provisions of the Open Meeting Law, General Law 30A, Section 18, and the Governor's March 15th, 2020 order imposing strict limitations on the number of people that may gather in one place, this meeting of the City Council will be conducted via remote participation to the greatest extent possible. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings in real-time video technology means. Alternative public access to this meeting shall be provided in the following manner. The meeting will be televised via Peabody Access Television, and the minutes will be transcribed by our stenographer and remotely. I would now ask you to rise for a moment of silence. And now the Pledge of Allegiance. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. At this point, I would like to ask Sharon Cameron to come before us and give us an update on the COVID-19 pandemic. Sharon Cameron is obviously our health director, and I now ask Sharon Cameron to come and speak before us. Sharon.
Thank you, councilors. I'm going to share my screen. Are you able to see that?
No, through the chair, I requested that you turn your video on. Did you get a message?
Okay.
Thank you.
Okay. Let me see.
There you are.
Okay. So how do I share the presentation?
I'm going to allow you to host the meeting so that you can share that.
Okay. So are you able to see it now?
It's just happening. Hold on just one sec.
There you go, Sharon. You are now the host.
You should be able to share your screen.
Okay. I have it up on the screen. Are you able to see it?
Nope.
Okay. How about now?
Why don't you verbally go through it?
Okay.
To the best of your ability.
Let me try it one more time.
There you go.
Here we go.
Okay.
There you go.
All right. Well, first, I'd like to thank all of you for the opportunity to brief you on the COVID response situation here in Peabody. I'll be sharing some data today about the city's, just general data about the status of cases in our community, but also information on the city's response efforts. Obviously with the focus on the efforts of the health department, because that's my area of expertise. But I did want to make sure that everybody was aware that the entirety of city government is fully engaged in our response efforts, not just every department finding ways to deliver their essential services in spite of the restrictions that they're experiencing on staffing and accessing buildings and other public places, but they're actually all actively engage in supporting the greater community response to the COVID situation in many different ways. And many of our businesses and nonprofits in the community have stepped up as well. So this is really a comprehensive community effort, and I don't want that message to be lost as I go through some of the details of the presentation. So I know there's lots of places for you to see national and international data. I'm not going to spend a lot of time on this, but I did want to point out this is obviously the international data. Right now, the United States has by far the greatest number of cases in the world. The cases in the United States represent about 29% of all the cases in the world. This is the situation across the country. Obviously, at this point, every state is affected, some more severely than others. And unfortunately, it does look like every state is going to be experiencing the impact of this disease. And you can see in the second half of the slide that the number of cases has really accelerated over the past few weeks. So I'm going to start sharing some more local data. This is still statewide data in terms of testing. As you know, there have been some limitations on the availability of testing throughout the state. This shows you statewide of all the testing that's been done, about 17% of those tests have proven positive. But as in the more recent week, we've seen a greater percentage of the tests that have been being done are being positive. So this is what it looks like in Peabody. These numbers were accurate as of earlier today, but as you can see, we're experiencing really rapid increases in the number of cases in the community that have been identified. And we believe that there are two reasons for this. One is that we are seeing an increasing availability of tests, so more people are able to be tested. But we also do believe that this represents an increase in transmission of the virus in our community, unfortunately. The other piece of information I would like to share is that these numbers really represent the minimum number of cases in our community. These are cases that are reported to us through the state's electronic surveillance system called MAVEN, and you'll hear more about that later. But generally, what that means is these are cases that have been laboratory confirmed and get reported to us. As this pandemic progresses, more and more cases are being clinically diagnosed, which means a clinician is diagnosing a patient based on their symptoms and their exposure history, and there may never be a lab test. In those cases, most of those do not come into our system, and we do believe there are many of those cases in our community. So this number here represents only a portion of the cases that are in our community. And that's why one of the messages we've been trying to give to people, you know, we've received a lot of calls. People understandably are very concerned about this data, and people, especially at the beginning, would want to know, well, you know, where were these cases located? What stores did these people visit? And really the message that we are trying to help people understand is that we really need to assume that anytime you're out in a public setting, anybody you come across anywhere could have the virus and be transmitting it to you. And that's why these measures about staying at home and only going out for essential errands are really, really critically important. So the cases, this case count is something that we update regularly every day or two. This more detailed demographic data that I'm about to share with you, I am working with an intern from one of the schools of public health who is able to help me break it out into a little bit more detail. And this is information I'll be able to provide updated on a weekly basis. So this is what the cases look like broken down by gender in Peabody. It replicates pretty well what we're seeing across the state. Is slightly more cases in females than in males. This next slide shows us, the age breakdown. And one of the significant differences I would like to point out is that in Peabody, we have a much higher proportion of our cases in our 70 and above age group. In Peabody, about 38% of our COVID cases are age 70 and above, whereas statewide, it's about 19%. Now, we do know in Peabody, we do have a higher percentage of elders in our population. And we also know that we also have many long-term care facilities in our community, and we have many elders who are living in congregate housing. So, and obviously when you're in a living situation where you're sharing housing, that poses a risk of transmission. So we are very, very concerned for this population in Peabody. This graph shows you what the hospitalizations look like in Peabody. About 10% of our cases in Peabody have required hospitalization, but I would like to point out that we have a whole big swath of cases that we don't yet have full data for. So it's possible that number could be different, but that number is pretty reflective of what's going on across the state of Massachusetts, which reports a hospitalization rate of about 9%. And the other graph I wanted to show, because everybody has heard the concern about the limitations on ventilators who are needed for the most critically ill patients, and whether or not we will be able to obtain additional ventilators as the surge progresses. And to date, about 17% of the Peabody cases that have been hospitalized have required ventilators. Now, this next slide shows that people who have underlying health conditions are more likely to suffer severe impact from the coronavirus and are more likely to require hospitalization. And that is information that we suspected would be the case, and it is in fact borne out by the data. This is the information about deaths, and unfortunately, we have had some deaths in Peabody from the coronavirus, and those deaths represent about 2% of the cases identified here, and that mirrors what's going on across the state. And here is some demographic information about the individuals who succumbed to the disease. The 3 cases that we had as of the 6th of April were elders in their 80s. So that is a snapshot of the local data. I wanted to review with you the role of the Board of Health. And we have we're not clinicians, but we do have some really important roles to play during a pandemic response. And probably the most significant role we're playing right now is surveillance. And you'll hear more about surveillance, but what that means is that we receive reports of suspected, probable, and confirmed cases of COVID. We identify people who may have been in contact with those cases, and we impose requirements for isolation and quarantine of people who have either been confirmed or who have been exposed to somebody. And we use this data to help us make decisions about the social distancing measures that we've all been experiencing. So when people are under isolation and quarantine, our public health nurses monitor them. They check in with them on a regular basis to see how their symptoms are progressing, to make sure that they have the supports they need to successfully remain in isolation or quarantine. I would like to note, though, that there are some individuals who are quarantining for other reasons. For instance, as you know, the governor has required anybody traveling into Massachusetts should be self-quarantining for 14 days. Those individuals are not reported to us, and so we are not actively monitoring their quarantining. Another really important role for us is to provide accurate information to the public. There's a lot of types of information we've been asked to provide. There's a lot of anxiety around the disease, and it's really our job to make sure people have the correct information they can use to protect their health and try to counteract some of the inaccurate messages that they get that may be harmful or may be doing nothing but increasing anxiety. So we are contacted by individuals about their own health risks. We're contacted about businesses concerned about how they can protect the health of their employees. We've done a lot of talk with institutions in a pre-pandemic phase about how they could prepare for the coming pandemic. And then lastly, our big role at a later phase of this emergency is once vaccine will be available, we will be out in the community trying to get as many people immunized as we possibly can. And in addition to being a direct provider of vaccine, we will serve as the distribution site of vaccine for other healthcare providers. And this was a model that we had the opportunity to practice during the H1N1 pandemic back in 2009. Contact tracing, I do have two of my nurses are here with me tonight, and at the end of my presentation, I'm going to ask them to elaborate a little bit more on the contact tracing, but I think it's important for you to know that the state has an electronic surveillance system called MAVEN. It stands for the Massachusetts Virtual Epidemiological Network. And through that system, there are over 80 diseases that get reported to the Board of Health for our public health nurses to follow up on, and COVID is just one of those cases. So even while we're responding to this emergency, we're still seeing reports about other diseases that we need to follow up on, things like tuberculosis, where our nurses still need to follow up to protect the health of the community. So that is all still happening during this pandemic. And I won't elaborate more on contact tracing. I'm going to have the nurses do that at the end. I know you've all seen this graph over and over and over again, but I just wanted to take a minute to really point out the importance of the whole concept of flattening the curve. And you've seen this, but the dotted line here represents the capacity of our healthcare system. How many doctors and nurses we have? How many beds do we have in the hospital? How many ICU beds? How many ventilators? All of those things is what we mean when we talk about the health system capacity. So the whole point of all the social distancing we've been doing is that this is the peak of disease, the red curve, if we're not implementing many of these measures when we don't have a vaccine. So you can see we have a big surge and we exceed the capacity of our healthcare system. When we implement the social distancing measures that we're doing now, by flattening the curve, we may end up having as many cases, but they're spread out there. And so we're not exceeding the capacity of our system to care for people. So hopefully people have access to the beds they need if they need to be hospitalized. They have access to the proper health care. And the other thing it does is it buys us some time so that hopefully vaccines can be developed and antiviral treatments can be developed. So this concept of flattening the curve is really critically important, as you've heard so many times over the past few weeks. So social distancing measures include things that we are all living through now: cancellation of mass gatherings, people working remotely, people modifying the way that they deliver critical services to the community. These decisions around social distancing at the beginning of the pandemic, these were really gut-wrenching decisions to have to make, because the people who are in a position to need to make these decisions recognize that they have a severe impact on the community. People lose income, people become socially isolated. They're not decisions that are made easily, and it's even more challenging because the most effective time to make those decisions is really before you get hit hard by the pandemic. So it looks like you might be overreacting when you actually implement these social distancing measures early, but that's when they're most effective. So I wanted to share with you some of the major activities we were involved in through the course of the pandemic. And, kind of the pre-pandemic phase, I did want to highlight that back in November and December and January, we did run workshops and a tabletop exercise for all the city departments on planning for an infectious disease emergency. The exercise we did was not around a COVID virus. It was actually around a different type of infectious disease. But the benefit of having that exercise is it really helped all the city departments to understand what their role would be in an emergency, what the role of their collaborating agencies would be in an emergency. So we had great participation. We had over 8 different city departments, and that really gave us a good head start as we headed into this pandemic. I won't go through the whole list, but we have a pandemic response plan that was first developed during H1N1 that we updated to address the COVID situation. When schools were still open, we started increasing our surveillance of disease in the schools by using our school nurses. There were enhanced cleaning protocols put into place in public buildings and procurement of cleaning supplies and personal protective equipment. We started to develop messaging for targeted communities. We developed messaging for the school communities. We did outreach to businesses. We started compiling resources for the city's website. One of the things that has been happening very well at many different levels is that as a public health director, I've been collaborating with the public health directors of the region. The chief executives of the communities are collaborating to the extent that communities can move forward in a consistent way around some of these social distancing measures. It helps in terms of sending a consistent message to the public so they understand the importance of following the guidelines. We activated our city's incident command structure for emergency response. Our police and fire and ambulance modified some of their dispatch protocols so that they could try to maintain responder safety when responding to medical events. And we did continuity of operations planning with all the city departments. And I do want to spend a minute on that. So the continuity of operations planning takes into account how we can continue to deliver essential services, even if we're looking at reduced staffing or limited access to facilities. You know, who needs to be cross-trained so that essential functions could be filled if we had a lot of illness in our workforce? What credentials are needed? Are there outside vendors we should be thinking about contracting with? All of these planning pieces were done very early on, and they were done by all city departments. We also put guidelines up early to help businesses prepare for their own operations. You know, we gave them guidance on enhanced cleaning, signage they could use to support good hygiene in their facilities. We had them start to look at their personnel policies to make sure that they didn't have leave policies that would penalize people for staying home when they were sick. We asked them to start thinking about when would you consider restricting travel? When would you make decisions about going to staggered shifts and remote work and things like that? So all of that planning was done early on. As we moved into the pandemic phase, one of the most important things we did is that we recruited and trained additional staff to support our surveillance effort. And this is an area where I think the city of Peabody was really at a great advantage, because the structure of our public health department is somewhat unique in that school nurses work for the Board of Health, as opposed to the school department, which is the norm in most other communities. So we had access, particularly once the schools were closed, to a much larger workforce of nurses who could supplement our surveillance response. So many of those school nurses have now been trained in the MAVEN system I mentioned earlier, and they are very actively engaged in the contact tracing. And you will have the opportunity to hear more about that from the nurses at the end of this presentation. Other things that were done during the pandemic phase is that, as you know, service delivery has been modified in many city departments. One of the major critical services in the community that I'd like to just highlight, because it's just such a great example of collaboration, is the need to continue to supply food for families in need. And this has brought together the school department, the Council on Aging, and community partners such as the Haven from Hunger and the No Child Goes Hungry in Peabody program, to make sure that not only families who, you know, they normally serve are receiving food, but there are many more families now because people have lost jobs. There are also other families in need because they're under quarantine and they're not going out to the grocery store and things like that. So this provision of food services is so critically important, and the city was able to collaborate to make sure that continues. As you know, many public buildings have been closed. In fact, all of them at this point. At the beginning of the pandemic, we were looking at flexible shifts, rotating staff. We've now gone to primarily a remote workforce wherever that's possible. We've built a lot of different ways to try to communicate information out to people. As you know, the mayor is using the reverse 911 system regularly. We're putting information up on the city's website, social media accounts. The Peabody Health Department has a COVID response line staffed with both our staff and volunteers from the schools of public health in the state. One of the collaborations I wanted to mention is we established in partnership with North Shore Community Action Programs and the Medical Reserve Corps a dedicated line called the Peabody Health Line, and that's using NASCAP's telephone infrastructure, but trained volunteers from the Medical Reserve Corps to field a lot of calls from concerned residents about not just medical and health questions, but questions about how do I access food services and how do I apply for unemployment, and all those sort of really important questions. That's a centralized resource we're trying to promote. Some other response measures, as you're all aware, the Parks and Rec Department and Public Services collaborated to make sure that playgrounds and ball fields were closed off. We've developed a system to share information with first responders about case locations so that the first responders are able to protect themselves when they're responding to calls. We're getting a lot of calls from employers with questions like, my employee's spouse works with somebody who is diagnosed. What does that mean for my employee? Do they have to go under quarantine? Those sort of really clinical, technical guidance take a lot of time, and we're doing a really good job providing that consultation. We're also helping businesses understand the governor's directive around essential businessing and all the safeguards they need to put in place to increase social distancing. We are doing enforcement of the business closures for some of the businesses that have not complied with the governor's order. And we're providing just a lot of general information, not just to the general community, but in particular, a lot of families of residents who are in long-term care facilities. So this next slide is just a partial list of some of the formal actions that have been taken at the state and at the local level in terms of declarations of emergencies, school closures, both first locally and then the state followed with a school closure, the state's ban on on-site restaurant consumption. There were local declarations of emergency both by the mayor and the Board of Health. The Board of Health issued a local order closing personal care businesses a few days before the governor did a statewide order closing non-essential businesses. Our building commissioner has issued local guidelines to ensure safety of workers on construction sites. The next one I wanted to point out there, the governor has issued a statewide order prohibiting gatherings of 10 or more people and a stay-at-home advisory. We are actually communicating the message that we do not want anybody congregating with anybody outside of their immediate household. So that isn't an advisory, but really that is the best advice, that even though you could gather 10 or more, the safest thing to do is not to congregate with anybody outside of your own household. The Board of Health did approve last week a moratorium on evictions during the period of this emergency. When we are asking people to shelter in place as much as possible, we do not want people at risk of losing their homes. And as you know, the governor issued a statewide order limiting occupancy on grocery stores. And the same day, the Board of Health was acting simultaneously on a similar order, which applies not just to grocery stores, but any essential retail establishment. So it would apply to all the grocery stores, but it would also impose the same occupancy restrictions on things like hardware stores and other essential stores that remain open. We're not there yet, but there's been conversation about when will things start to reopen. And the New York Times actually had a really good article this week that talked about what are the key criteria that would need to be in place before you would start making decisions to reopen things that we have closed down. And the first is that we have sufficient healthcare system capacity to handle a surge in patients, so that any patient who needed hospital level care the system would be able to accommodate them. Second would be that we've got enough testing resources to test anybody who needs it, anybody who has symptoms or anybody who's got a potential exposure. Right now, we don't have that capacity. The third is that we need adequate public health infrastructure to continue the contact tracing and to continue to oversee the isolation and quarantining requirements. Even when we're past the peak number of cases, which are expected sometime within the next 10 days, there is going to continue to be a certain amount of cases in our community. We will continue to need to do contact tracing, isolation, and quarantine, And if this pandemic behaves like other pandemics, there is the likelihood that we will see a second peak sometime possibly in the fall. And so we will really need to maintain a high level of infrastructure to make sure that we're able to continue this level of surveillance. And then lastly, we need to see a sustained reduction in the number of cases for at least 14 days. The fifth one is something that would be nice to have, which would be testing to identify individuals who had antibodies, meaning they had been exposed to the disease and are now, hopefully, they have some level of immunity. People are complying with the requirements to stay at home. We're getting more and more requests for assistance, people needing help with grocery shopping, and people, whose personal care attendants are no longer reporting to work and they're trying to find those services. So those calls are all coming into City Hall, and not just the health department, the mayor's office gets those calls. There are other departments probably getting similar calls. So this is going to be an increasingly critical need as we look at the days ahead. And again, I just wanted to reiterate the message that every department is working together, and not just government, community-based agencies, businesses, everybody is really stepping up to really try to meet the needs of our community while being mindful of the need to make sure our workforces remain safe. Information is one of the most powerful tools we have, and we're really trying to engage people in looking at credible sources of information and helping us counter misinformation that does nothing but heighten anxiety and doesn't help people do what they need to do to stay safe. As city officials, it's incumbent upon all of us to try to model appropriate social distancing behaviors. And then lastly, once this critical phase of the emergency has passed, it doesn't pass for the health department. COVID response is going to be our top priority for the foreseeable future. As I mentioned, we're likely to see a second peak at some point. We'll need to continue our enhanced surveillance, and hopefully when vaccine is available, we will be really fully engaged in pushing out as much vaccine to the community as quickly as possible. So this emergency for us is going to be a very long-term event. And that is the end of my presentation. So I know you probably have questions, but if I could, Councilor Rossignol, I'd like to ask if our public health nurses, Chassie Robinson and Brenda Wolf, would be able to just elaborate a little bit on the contact tracing.
Absolutely.
Through the chair, Sharon, you will have to go into them as attendees and turn them into panelists.
Can I just turn the meeting back over to you?
You could do that as well.
Okay, let me figure out how to do that.
Sharon, thank you very much for this presentation. It was amazing, and the work that your staff is doing has just been outstanding over these past weeks and months. I just want to commend you, Chassie, Brenda, and your whole entire team. I had the privilege of attending a few of your department head meetings via remote, similar to this fashion, and you are on top of everything, to the point that even the call-in number that we have localized is now something that is promoted by each individual city across the state. So before we go to Chassie and Brenda, I just wanted to commend you and your staff for just the outstanding job you've done through this entire crisis. So you need to be commended.
Thank you so much. We have such a great team, and I feel very fortunate to be supported the way we are in this community. So thank you.
My pleasure. All right, now I'll turn it over to, before I open it up to the council, I'll turn it over to Chassie and Brenda for final remarks.
Sharon, could you release the hosting?
I thought I did, but does anybody know how I can do that?
Go to your name under participants.
Oh, okay. Yep. And then what do I do?
I think it's the more button. Or double click on your name.
While they are transferring from one moderator to the other, I just want to go through the attendees attending this meeting. We have all the city councilors, Councilor Welton, Councilor McGinn, Councilor Mitsoulas, Councilor Charest, Councilor Sasslaw, Councilor O'Neill, Councilor Turco, Councilor Melville, Councilor Manning Martin, City Clerk Allison Danforth. You just heard from Sharon Cameron, and I am current Council President Tom Rossignol. I also just want to welcome the Mayor, Mayor Betancourt, and before I turn it over to you, Mayor, I will just wait and hear from
Councilor
Rossignol.
Rossignol?
Yep.
Would you just recognize that I am in attendance? You did not recognize.
Oh, sorry, and Councilor Gould, I apologize.
Thank you.
Mr. President?
I cannot find the button to release the meeting back to somebody, so somebody's gonna have to.
Councilor McGinn?
Thank you,
Councilor McGinn.
Thank you, Mr. President. While we're moving between presenters, maybe we could take care of an administrative item. I'd move to receive as a late communication the presentation from the Public Health Director, Public Health Director Cameron. So moved.
You heard the motion by Councilor McGinn. Roll call vote on the motion.
Councilors Welton?
Yes.
Councilor Sasslaw?
Yes.
Mitsoulas?
Yes.
Gould?
Yes.
Charis?
Yes.
Manning Martin?
Yes.
Turco?
Yes.
O'Neill?
Yes.
White.
O'Neill? Councilor O'Neill?
Yes.
Melville?
Yes.
McGinn?
Yes.
Rossignol?
Yes.
Motion carries 11-0. Through the chair, Councilor McGinn, could you give Sharon some advice on how to pass the hosting duties back?
Actually, Allison, I did. You're the host now.
Thank you very much.
So Chassie and Brenda, you are now available.
Yep.
We welcome your participation.
Chassie?
Oh,
you can
yes.
talk.
Okay, thanks. Sharon
Thank
did
you.
such a good job of, giving an overview, but I thought I might just give you a brief overview of what each public health nurse says to a Peabody resident when they're calling about COVID-19. So as Sharon said, COVID-19 is just one of over 80 reportable diseases, but COVID-19 is what we're spending most of our time on right now. As a public health nurse, when I first receive a lab report, I review the address, make sure the patient lives in Peabody. I only see lab reports. Let's see. Oh, okay. So I only see lab reports for people who live in Peabody. I check the lab report for the name, age, and phone number of the patient. I call the patient, explain who I am. I'm the public health nurse for the city of Peabody, and I explain the reason why I'm calling. So I tell people I'm calling because I want to make sure they're feeling okay and they're linked up with care. I tell them I want to find out where they might have been exposed to the virus. And then lastly, we need to determine if there's anybody else at risk for being exposed. So the public health nurse starts with a series of clinical questions asking about symptoms, symptom onset, any complications, any hospitalization, pneumonia diagnosed. I do some education with each patient about why isolation is so important. I inform the patient that they have to be isolated until they're no longer infectious. So for some people that's 7 days, for other people it might be 14 days or longer, depending on the course of their illness. I work backward from the date that their symptoms began. So people are infectious 2 days before their symptom onset until at least 7 days after their onset and possibly longer. The next series of questions that I ask a patient are about exposure risk. I ask people if they've traveled outside of the state or outside of the country. I ask them if they've had any contact with somebody that they knew had COVID-19 or somebody who had similar illness. And then I finish the conversation by defining the patient's period of infectiousness to determine if other people are at risk. I define who close contacts might be for the patient, and close contacts are defined as people who've been within 6 feet of the patient for more than 15 minutes. And also people who may have come in contact with direct secretions of the patient. So I ask people to give me a list of anybody they may have come in contact with and have had close contact with. And those can be household contacts, they can be friends, work contacts, but we make sure we have a really good list of names and telephone numbers so we can contact them. If the people are in the household, that makes it easy, but if people are outside the household, I then call those people and explain what quarantine means. And quarantine is something we use for people who are healthy, but who have been exposed to the virus. So it normally takes people 2 to 14 days to incubate the virus and develop symptoms. And so we want those people to be at home, away from other people. So if they do come down with symptoms, they haven't exposed other people. So I call those individuals, explain what quarantine is, and we have some really nice documents. We have documents and guidelines about what you can do when you're isolated and what you can't do, and also what you can do and can't do under quarantine. Because being under isolation or quarantine means that you must stay in your house away from public activities. And so we talk about if people have the medication, their daily medication and food and supplies to be successful during a 7 or 14 or possibly longer day of isolation and quarantine. At the end of the interview, I talk to people about the concerning symptoms that would warrant a call to their doctor or 911, particularly trouble breathing, pain or pressure in the chest, or new confusion that's out of the ordinary for the person. I give patients my telephone number to call with questions. I make sure they understand that it's my job to make sure they feel supported during their period of isolation. Again, that they have what they need to be successful. And if they don't, if they have somebody, a neighbor or family member that can drop things off at their door, but not come into the home. If they don't have somebody who can help bring them supplies, we work to link them up with somebody who can, and there's some wonderful resources in the community. We, as public health nurses, recognize that it's very difficult for an individual or a family to get through periods of isolation and quarantine, and so we try and do whatever we can to support the person. We also call at the very end. A lot of people need a work clearance document to get back to their regular activities, and we help them with that. So that's just what each and every public health nurse is doing in the city of Peabody on a daily basis for multiple people.
Thank you very much. Brenda, anything that you want to add?
So as Chassie just explained, as you can see, she is quite the expert in this area of surveillance and contact tracing. And as Sharon explained in the beginning through her presentation, we as the school nurses jumped in as soon as we possibly could, because we did require some cross-training of the MAVEN system. So myself and a couple of nurses jumped in right at the start of the epidemic that then therefore turned into a pandemic, and have since continued to pull in the public health school nurses within the last week and a half to provide additional resources. We've actually created almost like we have 12 full-time school nurses. We broke them out into 3 different groupings to better be able to delegate the tasks that keep coming in every day. 4 additional nurses have now started doing the MAVEN surveillance, along with myself and a couple of my substitutes that one of them that actually is bilingual, and that helps with speaking Spanish and Portuguese to our those populations in our city. The other group of nurses are dedicated to that COVID call-in line. They call in the line throughout the course of the day at the health department and are returning a lot of the residents' concerns and questions that they may have on a daily basis. And then the third group of nurses are actually, we're calling them are almost like our research team, because there's so much coming in through the governor's office and through CDC on a daily basis. All of these executive orders and guidelines are changing rapidly throughout the course of the day. So we have them dedicated. They're looking into various resources for us within the community and beyond. A lot of the facilities that we communicate with are looking for a way to increase their PPE supplies, which is their personal protective equipment. So we have the nurses looking in and outsourcing and looking for different areas that we can reach and pull in some more of those supplies. So as you can see, it's been a total team effort, and you know, it's just been a big learning curve for all of us, but we're doing it.
As I said to Sharon Cameron, I can't thank you ladies enough for your hard work, your dedication, and everything you've been doing through this entire process. The only question I had for Ms. Cameron is, if the schools open up and the nurses kind of go back to the schools, will you have some sort of outreach program for the community to try to engage nursing from the community to help in this type of program, or is that kind of too far ahead in the future?
I think by the time that schools reopen, the number of cases in the community will have gone down dramatically. We will still need more. During normal times, we really only have one public health nurse chassis in the community to do the surveillance. We're going to continue to need, right now we have about 9 nurses engaged in doing surveillance. By the time we're in a position to reopen schools, we may need 4 or 5 nurses. So we are going to continue to need resources, and it may make sense for us to think about continuing to engage the school nurses who've already been trained in the surveillance activities, and maybe look for other ways to supplement the school nursing staff. But we haven't planned that far ahead.
Okay, thank you very much. I'm now going to open it up to the council for any questions. But before I do, Mayor Betancourt, thank you for attending. If you have anything that you'd like to add at this moment, please feel free.
Great. Thank you, Mr. President, and thank you for the opportunity to speak on this. First, I just want to wish everyone the best. I hope everybody's doing well, all of you, your families, during this challenging time, difficult time. I want to thank all of you for really your flexibility, your adaptability, and your commitment to serving our residents. We have all been in touch, trying to do the best we can to serve the needs of our residents, and it's going to be a challenge. It has been a challenge, and it will continue to be so. So we just have to stick together as best we can. A lot of my work over the last few weeks has been just really keeping up to date with information. Every day we're on conference calls, trying to gather information as best we can. I've been trying to get out information to all of you and to the residents with the robocall, which has been a terrific mechanism for us to get information out, and just trying to keep people updated as best we can, and trying to serve the different departments. And there's a lot of not only concern about the disease, but also just a lot of anxiety and stress. And I have a lot of concerns, I know we all do, about just making sure that we can try to help people who are home alone and serve their needs with medications, food, things of that nature. So it's been a challenging time. I just really want to thank the heroes in our community have been Sharon, Brenda, Chassie, our nurses. Just been a tremendous job reaching out to people and gathering information and keeping everybody together. I can't say enough about what that team has done, our Board of Health. And also I wanted to recognize our food service. A lot of the work that's been going on, particularly in our schools, has been in serving our free and reduced lunch students, their families, veterans, some seniors that need assistance at the Council on Aging. and so many people have stepped up to help. We're serving right now out of 3 schools, the high school, the middle school, and the Welch School. And this past Monday, we had over 700 families that did a grab and go, which has been increasing every week. We had some initial bumps in the road, and I think things are getting a little smoother, but that's been a process that has to be reviewed every week. We met this morning, or had a conference this morning, to try to get ready for the next couple of weeks. And we're going to continue to try to do that. I wanted citizens who've been terrific. The No Child Goes Hungry in Peabody program has just been terrific with volunteers, additional groceries, and we've been able to get out a tremendous amount of food to people, as well as continue the work that's taking place in the schools. Dr. Kerbel, Dr. Lord, our principals, our teachers, our cafeteria workers, our custodians, our paraprofessionals have all been doing the best they can, and really stepped up and helped the community in so many ways. So I just wanted to state that. I did get onto the conference here a bit late. I didn't hear the whole presentation from Sharon. I caught the end of it. But her and I have been speaking pretty much every day, multiple times a day, going through things. So I just wanted to listen in, maybe answer any questions that you may have as to things that I'm working on. I've been really trying to keep in touch with our local mayors, trying to have a united voice as to what's going on in Salem, Beverly, Danvers, Lynn, and trying to be a part of those group meetings and trying to make sure that I'm up to date on all the information I can. So, and I know Sharon has been doing the same. So thank you for all the work, and I'm here to answer any questions. I just want to be a part of the discussion. Thank you.
Thank you very much, Mayor. Thank you very much. I'll go now to Councilor Gould.
Thank you, Mr. President. Thank you, Mayor. Sharon, thank you so much for everything you do. You're the calming voice in this storm. You really are. Your professionalism is second to none, so thank you. Sharon, how recent were the 3 deaths?
I don't have the exact dates. I think we had the first death approximately a week and a half ago. Chassie might be able to respond to that.
No, that's okay. No, I just curious how recent it was. Sharon, what can we do as a council to help you? Anything you need? Do you have enough money?
I'm spending the money that I need to get the job done, and hopefully you guys will find a way to pay for it. So we did receive a grant from the as you know, the governor did push some money out to local health departments to kind of just get us jump started on the emergency response. And our share of that money was $40,000, and almost all of that money is going to go towards the nurse staffing that we've brought in to do the surveillance. So it's probably not going to cover all of our costs.
Do you have enough PPE?
Yes. Chief Daly has really done a great job in terms of managing the PPE inventory. We don't have much of a demand for PPE because we're not doing the work that the nurses are doing is remote, and we're not interacting with patients. Our inspectors are doing a lot of support to businesses, but it's all being done remotely. So we don't have much of a need for it at this stage. It's possible that that could change depending on if we were given vaccine and, you know, things like that, but that's still months away, if not longer. So right now the PPE is really earmarked for first responders, as it should be.
Do we have any first responders that have tested positive?
That would not be a question we could answer for you.
Okay.
We have to protect confidentiality.
Okay. Thank you very much.
Councilor Melville.
Thank you very much, Mr. President. I had a question for Sharon. Sharon, first of all, this was great. Just two questions. This was that PowerPoint. Are you going to be able to make that public on the website?
Yes, I was planning to put the data up on the Health Department Facebook page, but I certainly can put the entire presentation up.
I think it was really, really helpful. I know you had talked about, you make a point a couple times about disinformation or bad information. I thought that PowerPoint was it's scary, but it's good information to have, and I think it's helpful if that's can be disseminated. The second question I had was the big issue I saw in Massachusetts, which I think is doing a great job from the governor on down, is there was that issue at the Soldiers Home in Holyoke, which is a senior living facility. And you had mentioned we have a few senior living facilities in Peabody. If there was an issue, they would have to contact you directly, correct? It sounds like there was a communication early on in that scenario. I thought we have like 6 or 7 of those places in Peabody. They would deal directly with you in that, and they would report it immediately, obviously.
Yeah, there are 6 long-term care facilities in Peabody, and our public health nurses, we've assigned each facility to a public health nurse to kind of be responsible for being their point person. The nurses reached out to the facilities last week and had a conversation with each one of their administrators about making sure they understood and were following the federal guidance around infection control. They are required to report any cases both to us and to the state health department. And anytime there is a cluster, and unfortunately we do have some facilities with some clusters in Peabody, the state health department will assign an epidemiologist to that facility to do monitoring of any cases as well. So that is a big priority of ours, to do monitoring of our long-term care facilities.
Great, thank you very much. I thought this was a really well done presentation. I think it's also worth noting that you had done a tabletop exercise dealing with a pandemic essentially 4 months ago. So that tells you a lot about being prepared. Thank you very much, Sharon.
Thank you.
Any other councilors would like to ask Sharon any other questions? Councilor Welton.
Thank you, Mr. President. First, just thank you so much, Sharon and Brenda and Chassie, for your incredible support and guidance and commitment to seeing us through as a community. I think I speak on behalf of all the councilors. We're eternally grateful for all of your support and hard work. Just a few questions, as Councilor Melville had brought up, asking about if there are public health nurses that are assigned to some of the congregate housing. Are you doing that as well for some of the group homes that serve individuals with disabilities that are in Peabody?
We don't have any nurses particularly assigned to those group homes, and I don't even like to say we don't necessarily even know where all the group homes are. There's the privacy issues that they don't disclose locations to the communities always about where they're located. So I don't know that we have a handle on where all the group facilities are, but they would be required to report cases to us. And so if we were seeing cases come in from the same address, that would trigger us to have an understanding of what needed to be put in place there. But I'm going to actually ask Chassie to elaborate a little bit more on this one.
Yes, I think just exactly what Sharon said. If we saw a number of cases being reported from the same address, we're putting one nurse in charge of that address as a little cluster. We're doing that for businesses. We would do it for a group home. Actually, if there was just one case in a group home, we'd take it very seriously and spend a little bit more time, because in a setting like that where people are living so closely, the chances of virus transmission are just greater, especially when we identify a location where people's immune systems might be compromised. We spend a lot more time and effort with that group of people just to institute as many interventions as we possibly can to prevent spread of illness.
I think if it's helpful, I mean, my 9-to-5 job is with the Northeast Arc, and I know we have a number of group homes in Peabody. I'm sure there's contacts at the Department of Developmental Services that, given this unique situation that we find ourselves in, I know there's always HIPAA concerns and things like that, but I'd be happy to connect with you, Sharon, offline, and if there's any resources that I have available to help out with that, I'd be more than happy to do so.
That would be great. Thank you.
No problem.
Councilor O'Neill.
Thank you, Mr. President. Through you, I'd like to just, I want to certainly echo the other councilors' comments. The mayor, Sharon's entire department, and Brenda, Chassie, and the other department heads really just doing a great job communicating to residents important information without betraying anyone's personal health information. I just had a general question that, we see, I think most recent information from the CDC is saying, people should likely wear masks in public. Can I just get your comment or thoughts on rubber gloves, whether that might give people a false sense of security, and that once someone goes outside to go, essential food shopping or whatnot, maybe it's better just to come in and do, hand washing than rubber gloves? Just curious if you.
Yeah, I don't use gloves when I go shopping because I agree with you that it's much more important to be aware of what I am touching and to wash my hands when I'm done. And I do think the gloves give people a false sense of safety. I don't think it's a bad thing, but I do think it might make people less vigilant about doing the hand washing if they feel that they've been sufficiently protected with gloves. The other message we're trying to really help people understand is that even though it is possible for the virus to live on surfaces like that, the way this pandemic is spreading is primarily through droplets from people being in other people's space and breathing in droplets that somebody has emitted by speaking or coughing and that sort of thing. And that's really what people should be paying more attention to.
Great, thank you, appreciate it. Thanks for your work.
Thank you.
Councilor Charest.
Can you hear me now?
Yep. He's muted. Councilor Charest, you're muted.
Can you hear me now?
Yes.
Sharon, I just want to say thank you for all the work you've been doing since day one of your hired on everything you've been doing. It's been great. You gave a great presentation, and I'm hoping the PowerPoint can be shared with everybody. You gave a lot of information. On the a couple of things, the PPEs. Is Public Works, I know they're out there doing some work and they're in the public, out in the public. Are they getting the proper PPEs also?
I think Bob Labossiere is in this meeting, and Bob and I have spoken about precautions for his staff about, splitting staff up so they're not sharing vehicles and things like that. So I know that he has been very on top of the safety of his staff, but I think maybe we can defer that question to him.
Sure. Bob, you there?
I'm here. Can you hear me?
Yep.
Yeah.
All right. Yeah, the Public Works does have PPE. We have cases and cases of gloves at our facility. We have been talking about masks. Some of our guys do have masks. We're trying to get everybody to wear their masks during the day. We'll be discussing more with the fire chief to see if we can get more masks for the guys to go out with. But other than that, we have enough gloves and whatnot for them.
Great. The only reason why
Bob,
I'm
text
asking,
me offline.
okay. I know they're out there doing the public work, so it's great to hear that. The other thing, Sharon, when you talk about the number 5 for the the testing to see if the people had the virus in the past, when do you think that might be coming available? Do you know?
I can't even make a guess. Yeah, okay. I don't know. Chassie, do you have any insight on that?
I've heard that Beverly Hospital, I've only heard about Beverly Hospital having the technology, but that wouldn't be using it for a number of weeks. So I don't believe the state is doing testing. And I don't know any facilities that are doing testing currently. So I think we're a couple weeks away from that.
A couple of weeks, well, that's encouraging that it's short term like that. Again, on the percentage of numbers of 179, you said, of the residents here in Peabody, their percentage of how many of those are including a household? Sharon?
I'm sorry, I didn't get your question.
Of the 179 people we have approximately, and I know that number is higher because it hasn't been reported out. Out of those numbers, whatever that number is, the percentage of that number being households, can you give a number of that?
Yeah, Chassie.
You know, I didn't calculate that number, but I will say that when we have an index case, our first confirmed case, and we are seeing transmission in the household. These are the people who are in close contact all the time. So I would just say it's very common to see transmission in the home, unless the individual has been able to completely isolate themselves from their spouse and their children. And some people are able to do it, but it takes real effort, and it takes a whole separate part of the house to do that. Not everybody's able to do that. And in homes where they can't completely isolate, we are seeing transmission.
So could I say that there's a high rate of a percentage of that 179 is because of a household?
We are seeing small clusters in households, yes. It's hard to say because we didn't run the numbers on that. So I don't have a number, but it's a very contagious virus, and it spreads in a household. Okay. I guess.
And again, I just want to say, I commend Sharon and her staff of what they've been doing. It's amazing of how hard your staff and yourself is working. You deserve one hell of a vacation when this is all over. It may be a while, but you certainly deserve that. I thank you. My family thanks you. I know the residents here in Peabody thank you.
Thank you very much. Counselor, this isn't a direct answer to your question, but I think it's somewhat related, and I think it's very interesting. And Chassie, I'm going to ask you to expand upon your observation that the circle of contacts you were seeing became smaller after we implemented social distancing measures. Could you talk about that for a little bit?
Sure, that's absolutely true. Maybe a week into investigating cases, our first cases were people who, some had some travel history. They'd traveled to a different state or out of the country. But after about a week, when we were investigating each case, more and more people were saying, when we asked, like, where did you go once your symptoms began? And most people were reporting to us, well, I didn't go to work because my work site had closed down and we'd moved to telecommuting. And, I wasn't going to the movies. I wasn't doing any of my normal activities. We normally ask people, where do you go to church? What do you do at night? Have you been out to dinner? And none of those things were possibilities for people when we started investigating. And so it made our jobs easier because they were just linked to their household contacts. And so as we go forward in investigating, we're just the amount of contacts for each person is getting smaller and smaller, which has been really helpful. Yep. So it does work, shutting down work sites and things like that. It does work, the social distancing.
Again, thank you very much.
Mayor Betancourt, did you want to chime in on this topic? Hold on, you're muted. There you go.
Thank you. Yeah, I just wanted to add to give some more information to some of the questions that have been asked, because certainly a big discussion has been about what we have for PPEs. Certainly want to make sure our police officers, our firefighters, DPW workers, those that are helping with our food service, and even just workers at City Hall that are coming in to get some work done. We have partnered with Salem, Beverly, and Lynn We've just recently done an order bundled together to obviously get a better deal, to order some surgical masks, some N95s that we're hoping to get, and also some cleaning equipment as that work goes on at our schools and our public buildings. So we're expecting a large shipment to come in the next couple of weeks. I don't have a number yet. It's depending on how much we're able to get. But we also want to make sure our police officers, firefighters have what they need. And I just want to say too, our two chiefs, both Chief Griffin and Chief Daly, they're both such calm, reassuring people, just tremendous leaders that have really been working hard during this. A lot of pressure is on our police officers, firefighters are responding to calls, and they're doing a great job, and they need to be supported as well. So we're continuing, even though we have a good supply right now of PPEs, I think we want to have more available for our officers and our firefighters and our DPW workers. So that's ongoing as well.
Thank you, Mr. Mayor. I'll now turn it over to Councilman McGinn.
Thank you, Mr. President. Through you to Director Cameron, at the, I think it was the most recent Board of Health meeting, there was some talk of providing some guidance to the large or the multifamily housing units to where I guess there's been some identified clusters and the potential there is higher for it to become a cluster. Has that guidance been developed? I think you had mentioned you were working with another municipality, Winchester, possibly.
Mm-hmm.
And have you been able to get that done and pushed out?
I received the draft of that document today. It is a collaboration with the Winchester Board of Health, and that's my task for tomorrow. I'm hoping to finalize that draft and get it pushed out, if not tomorrow, then over the weekend. I wouldn't say that we've had clusters in apartment buildings, but we definitely have had cases.
Okay, thank you for that clarification. And so when that guidance is, when you've finished that draft, are you going to push it out, or is it also going to go on the city's website with the other materials that are out there currently?
Yeah, so it will go on the city's website. It'll get put up on the health department Facebook page. I think the mayor has been doing weekly reverse 911 calls. We could have it mentioned there. We have contact information for many of the managers of the large apartment complexes because we deal with them for certificates of fitness. So we'll also email them directly to those larger complexes. A lot of the smaller multifamilies, we won't necessarily have the ability to do that, but the larger complexes we will.
Great. I mean, through the assessor's office, perhaps you could have contact information for the smaller multifamilies if it made sense to push it to the property owner as a suggestion. It's been said here over and over again. I'm just gonna say it again. I've attended some of these recent Board of Health meetings that have been focused on addressing this current health emergency, and I've been pretty effusive in my praise of the health department in the past, and but this current situation really highlights the high level of competence and professionalism that we have under Director Cameron and her staff, and we are very fortunate to have them. I want to thank them, the entire health department team as well, and especially the nurses that are on the front line of this here in Peabody and doing everything they can to keep Peabody as safe as possible. So thank you very much. Thank you, Mr. President.
Thank you very much.
Councilor Turco.
Thank you, Mr. President. Through you to, actually I can go to Chassie Robinson if you don't mind. In regards to the 179 cases within the city of Peabody now, have we been able to develop a common denominator amongst those 179 cases? And I ask that in the sense that maybe we can, is there any way we could expand upon social distancing if any of those cases are related to specific areas or, for example, walking trail contact or through certain establishments? Have we been able to narrow that down at all?
No, in fact, Brenda and I were talking about this today. When we look at the addresses and talk to people, it's in every neighborhood, every community. A lot of people we talk to really they didn't travel. They don't know anybody else with similar illness. They really don't know where they were exposed.
Okay, that was my only question. I'll just end with the fact, that, and I'll reiterate with my fellow councils, say, I've always felt that the health department has been the biggest asset for the city of Peabody. So while I have you all here, I just wanted to say thank you very much.
Any further comment from councils? Seeing none. Sharon, Chassie, Brenda, again, I'll echo what the rest of the council has said. Your work throughout this whole process has been nothing but stellar, and we can't thank you enough.
Thank you very much. We really appreciate all the support.
All right. Thank you. I'll now call on Councilor Gould for approval of the record.
Move for the record, Mr. President.
You
For
heard the
both
motion by
weeks.
Councilor.
I think 2 sets of motions, Mr. President, 2 sets of notes
Yep,
for
two
both
separate
weeks.
motions.
Thank you.
So we'll take February 27th first. Roll call vote.
Councilors Welton,
Yes.
Sasslaw,
Yes.
Mitsoulas,
Yes.
Gould,
Yes.
Harris,
Yes.
Manning Martin,
Yes.
Turco,
Yes.
O'Neill,
Yes.
Melville,
Yes.
Ginn,
Yes.
Rozignol.
Yes.
Motion carries 11-0.
Now from March 12th minutes. Roll call vote.
Councilors Welton,
Yes.
Sasslaw,
Yes.
Mitsoulas,
Yes.
Gould, Gould,
Yes.
Charis,
Yes.
Manning Martin. Yes. Turco,
Yes.
O'Neill,
Yes.
Melville,
Yes.
McGinn,
Yes.
Rozignol.
Yes.
Motion carries 11-0.
Next item on the agenda is the process for future public hearings. I've spoken to a number of you individually. Moving forward, the process for public hearings will be as followed. There will be email accessibility to the city clerk under a specific heading. Under the subject line will be, in parentheses, agenda, and then either a statement in favor or an against, and then whatever that email should entail. Then we will do the hearing. Then we will take a recess from the hearing and hear it a second time, with again the opportunity for the public to participate via email through the same process up to 48 hours prior to the meeting. That'll give the city clerk's office ample time to formulate that into a packet that we could then disseminate and have before us. Not only will we have email accessibility for our public hearings, but we will also have Zoom accessibility. Zoom participants will be real-time during the public hearing. They will be attendees in this process, and they would be unmuted as called upon by their telephone number. During this process, I just want to make sure that it's very well known that it is a federal crime to Zoom bomb or to inhibit or disrupt a public meeting in any fashion, and the disrupting party will be prosecuted to every extent that the law provides. We will have record of their telephone number, but that will not be telegraphed on PAT, but we will have that so that the person will know who we're calling on by their telephone number. If the caller is derogatory in nature or inappropriate at any time, the call will be removed and we'll move on to the next caller. During that process, we do not have the capability of the caller ahead of time saying either for or against the particular hearing, so they would just be heard as a group. Lastly, on this topic, I lost my train of thought. I apologize. So there will be a running record during the meeting through the Zoom process, and there will be a running record of the emails that we have provided to us by the city clerk's office. The notification of the meetings will be seen on PAT and it will be on the city website. If somebody wishes to Zoom into the meeting at the time of the hearing, that will be posted on the city's website, and it will be under the calendar section of the city's website. So that's going to be the process moving forward, going through hearings. Any questions or comments or concerns on the process? Actually, before I open up to the council, I will turn it over to the city clerk, Allison Danforth, if I forgot anything. Before I turn it over to the council, I just have to thank Allison Danforth, the city clerk, for the amazing job she's done to try to put this together and the hard work that she's encountered over the last 2 weeks, establishing this process to make it as accessible as possible for the public, and yet continuing to allow us to do the city's business. Before I turn it over to the council, Allison, anything that you want to add that I've forgotten? I'll also ask Attorney Khan to speak after Allison if I forgot anything.
I think Councilor Rossignol has articulated pretty clearly the process going forward, but if anyone has questions, please ask.
Councilor Welton.
Thank you, Mr. President. Just as a point of clarification, in situations that would dictate a neighborhood meeting, would the same technology and procedure and protocol still apply for that provision as well?
So a neighborhood meeting, if that was to happen, that would be handled by the ward counselor. That would be established in the same sort of format, but that has not been specifically addressed. Subcommittees would be handled in this same manner. So if there was a subcommittee meeting and the chair of that subcommittee wanted to have public input and they wanted the public's feedback in whatever subcommittee that was being held, they would be the moderator, they would be the chair, and they would control the meeting just like is happening right now. And I would assume that that same process could happen with a public meeting, but they would be a little bit more difficult.
Thank you, appreciate it.
You're very welcome. Councilor Gould.
Thank you, Mr. President. So just so we can be specific, this is going to be until further notice?
As long
then we
as
will be conducting
are,
business this way?
Correct. As long as we are under quarantine and as long as we are social distancing, this will be our meeting process going forward. Our meetings are always held on the second Thursday and the fourth Thursday of every month, so that's not going to change. I'm trying to keep this as business as usual to the best of our ability. Obviously, this isn't anything that any of us have planned for, but I think through this process, we are going to try to maintain our ability to do the city's business the best to our ability.
So specific, we're meeting in this format on the 23rd of April, and the
Correct.
14th and 28th of May are left to be seen what happened.
Correct.
The 14th and 28th is still up in the air.
My assumption is this will be the format going forward unless the governor or the mayor or the president issues alternative settings and social distancing isn't a figure of speech any longer.
Thank you, sir.
Councilor Sasslaw.
You have to unmute your microphone.
Please
Counselor.
unmute yourself.
Thank you, Council President. I appreciate all your communication and reaching out and getting this meeting here tonight. I did have a question regarding the other boards. I did notice that some had been scheduled and they were canceled. Specifically, I guess that'd be the Zoning Board of Appeals and the Planning Board. Are they now going to try and go forward with the same technology? And I only asked that because I saw some posted and then canceled. I was just trying to figure out what was going on.
My understanding is that, especially with the Zoning Board of Appeals, that is directly the public's business, in my opinion. I can't speak for that board. I can only speak for the council and what the city clerk's office and what we're trying to accomplish. My fear is we have budgets coming up, even though it's going to be a completely uncertain time for us. What I don't want to have happen is moving forward, if we don't have, if the social distancing is a thing of the past, all of a sudden we have such a backlog that we're having copious amounts of meetings that are really cumbersome to getting things accomplished. So my goal throughout this process is to really just trying to get through what we need to get through in a timely manner.
Sure. And if I could, through you to the city clerk, Allison, do you know anything with the ZBA and the planning board, what their situation is?
I believe the ZBA has decided to suspend all meetings until the COVID crisis is over. And I also know that the planning board is still holding meetings.
Thank you. Appreciate it. Thank you very much.
Councilor Melville.
Thank you very much, Mr. President. I've been talking to a number of communities throughout the state, mostly towns that are the smaller groups. One issue that's come up amongst doing meetings like this is advertisement and butters notifications, that sometimes they're not clear on how to voice those issues. So either through you, Mr. President, to Allison, is that going to be part of the advertisement and a butter notification and how to communicate if somebody, or what the actual format will be?
Yes. What will happen is part of the notification, and pardon me for speaking for Allison, and she'll chime in a second. Part of the notification will be where to access the Zoom notification for that specific hearing. Obviously, you can't give the Zoom address because it's going to change. And that's one of the security measures that Zoom has, is the reason why this meeting is a different Zoom address than the planning board than other meetings, is so that it can have some sort of security. But a link to where it will be accessed will go as part of that. Allison.
So if you'll notice, the agenda this week was 3 pages long. The first page was a little different than usual. We had meeting notice and agenda. And at the bottom of that, it had all the links to the Zoom webinar. So I can actually get those, I can log those dates in and get all those codes weeks in advance. So we could try to figure out a way to add those onto the legal notice itself. So when we send the abutters notices out, we will have that on there. And we're also posting them on the city website, and we're also posting them on PAT.
Very good, thank you. I just wanted to, I know that there's some towns that are having some controversy with the advertisement, the abutters notifications, and I think I just wanted to bring it up as one of those things that you can avoid. I appreciate everything you guys are doing. This is a wild time, and you guys are making the best of it. So thank you for everything you've done.
Thank you. Any further comment by council? Attorney Khan, would you like to speak?
Certainly. Can you folks hear me?
Yes.
Yeah, I just wanted to point out that the way this meeting is being conducted is in compliance with Governor Baker's emergency order of March 12th, which permitted deviations from the open meeting law and allowed us to hold remote meetings as long as there were alternative means of public access. So in my opinion, the way you're conducting this meeting is in full compliance with the governor's order.
Thank you for your input, Attorney Khan. Any further questions by the councilors? Seeing none, we will move on to the next agenda item, which is the Finance Committee item. And at this point, I will turn it over to Councilor McGinn.
Councilor McGinn, I'm going to make you the host.
Yeah, first a motion, under suspension of the rules, move to take item 4A and 4B out of the Finance Committee for direct consideration by the full City Council at this April 9th, 2020 Peabody City Council meeting, with the portion of the meeting addressing such matters to be chaired by the Finance Committee chairperson. So moved.
Could you amend that motion to include 7A?
My expectation was that 7A would be referred tonight, not taken up. Is it your preference that we take that up tonight, Mr. President?
I would take that up this evening, please.
Okay, we can do that. So amending the motion to include items 4A, 4B, and 7A. So moved.
You heard the motion by Councilor McGinn. Roll call vote on the motion.
I have no control. Councilor McGinn, you'll need to unmute everybody. You go to panelists.
Roll call vote.
You go to panelists at the bottom of the screen. Unmute all.
Councilor Manning Martin on the motion. You have to unmute yourself.
Yes, thank you, Mr. Chairman. Through you to Councilor McGinn on 7A, this is a financial request, and I know you wanted to hold it. Our council rules, this has to go to finance first, correct?
Yeah, so I mean, my intention would have been to refer that to Finance Council Manning Martin through. However, I guess we just need to address if there's any time sensitivity to it, and that we would be allowed to take it up, but it would require a suspension. So that's in fact part of the motion.
If I could, Mr. Chairman, what's
You have the floor, Manning Martin.
what is the exigency that we wouldn't abide by referring it to finance? And I know this isn't your wish, so I guess it's not a question for you, Councilor McGinn. Perhaps to the City Council President. What's the exigency that we're skipping that important step to go to finance?
I will defer that question to Mike Gingras at this moment. If Councilor McGinn can unmute Mike Gingras.
Can you hear me?
Yes.
All right. No, we could defer that to the next meeting.
Fair enough.
Thank you. It's such an important step to stop, to have everything reviewed in finance. We need to pay attention to that. So thank you.
I agree.
So with that, Mr. President, the motion is as originally stated, and it covers items 4A and 4B only.
Here's the council You heard the motion by Council McGinn. Roll call vote.
Councilor McGinn, if you could unmute everybody.
Council McGinn, if you go under panelists and you can click unmute all.
Yeah, unfortunately, I don't have a. Sorry, I was doing it individually.
No worries.
Councilors Welton,
Yes.
Zasloff,
Yes.
Mitsoulas, Gould,
Yeah.
Karas,
Yes.
Manning Martin. Manning Martin. I
Yes.
need
Can you-
an audio
Yes.
response. Thank you. Turco,
Yes.
O'Neill,
Yes.
Melville,
Yes.
McGinn,
Yes.
Rozignol.
Yes.
Motion carries 11-0.
I'm turning it now over back to Council McGinn.
Thank you, Mr. President. So item 4A, councilors, is communication from His Honor the Mayor regarding a bond order, transmission main pumping station and paving in an amount of $4 million. Here to address the council on that this evening is Director of Finance, Mr. Gingras.
Thank you, councilors. Last April, we came before you and we had two bond orders, one for 28.6 million, another one for 9.5 million. And that time, the original estimates were for those amounts. Now that we've gotten some real numbers, we have the bids in on the pipeline. We've got professional formal cost estimates for the Winona project. It seems that the 28.6 is going to be around 4 million, 4.6 high. And the 9.5 million for the pipeline was approximately 4 million short. So at the end of the day, the total between the two projects isn't going to really change, but there's going to be a shift. But at this point, what we're looking to do is bond the $4 million for the pipeline. And at some point in the future, once we get through all our SRF requirements and DEP requirements, we'll come back and reduce the $28.6 million bond order that was done last April.
Thank you, Mr. Gingras. Councilor Melville.
Thank you very much, Council McGinn. Mr. Gingras, does this correlate with, we're still going through that Clean Water Trust, correct? To get that advantageous interest number. Is that part of this bond or is this separate?
No, that's correct. For at least the 2 million of the 4 million, which has to do with all the direct costs of the pipeline itself, that will be picked up as part of the SRF trust funding, which is, we're going to put it out for 30 years, and I believe it's around 2.5% for the interest.
Okay, so this doesn't impact that at all. This is just about which side of the project that the original numbers will be reallocated, correct?
That's correct.
Thank you.
Thank you, Councilor Melville. Councilor Sasslaw.
Thank you, Counselor. So I was just trying to understand, Mike, if we know one part is going to be under 4 million and the other is going to be over 4 million, why do you have to even go out and bond the additional 4 million when you know the water treatment plant is coming under $4 million? I was trying to understand why. Is there something legally regarding that, or?
Yeah, that's really it. The specific wording in the 28.6 million amount is different than the wording in the 9.5 original amounts. So the wording in the bond order you have before you today is just slightly different.
Okay, and then in the communication, it says on the 28.6 million water treatment plant plan that will not be used and can be rescinded in the future. That's not going to disappear. We're going to actually, that does have to come back to, for lack of a better word, we'll be back into the general fund.
Well, what would happen is we wouldn't borrow that money, and at some point we'd come back to the council and actually rescind that piece of the bond order.
Okay, I understand. And then the only other question, when I was looking at the analysis of the shortfalls, if I just go, it says like the project and the bid price. So the West Peabody pump station, that doesn't mean that was $1.2 million shortfall on that piece of the bid, was it? And then the next one was 3.2. I'm just trying to understand it, and I found it a little bit confusing to follow the numbers, because then if you add it up, it looked like it was an $11 million shortfall on it. And I know that's not the case, but how I'm trying to understand the chart here, and I don't think I'm understanding it. Maybe you can help me out.
Sure, that first part of the chart are the actual costs, the bid prices. So it's 11.2 million for the project itself, as opposed to the 9.5.
So 11.2 was, say that one more time, please.
Okay, so it says West Peabody Pump Station, 1.2 million.
Yep.
That's the bid price.
Okay.
3.2 for the contract one, 4.3, 4.4 for contract two. Those are all real numbers.
Okay. So 11.275 was the actual prices, and we only appropriated 9.5 million.
That's correct.
Okay, thank you. Appreciate that. No further questions.
Thank you, Councilor Sasslaw. Councilor Turco.
Thank you, Mr. Chairman. Through you to Mr. Gingrich. Mike, why are we taking this path? You know, much to Council Saslaw's point, if we already know we need to rescind the original bond order, I would feel more comfortable rescinding that bond order minus the $4 million and then passing a new bond order with the additional $4 million, so that we don't have an $8 million bond that we don't need out on the table. So I'm kind of curious as to why we just didn't rescind this tonight and start from scratch.
The reason why is a lot of this is tied up in paperwork with the DEP and the SRF, and we haven't got the formal pricing on the Winona treatment plant yet. And once all that happens and we have real numbers and it's all concrete, then we could come back. In the meantime, we're holding up the contracts for the other piece for the pipelines until we have this additional appropriation. So it's cut. In the ideal world, we would have done them both at the same time.
Thank you. So with that being said, when can we expect to have that before us to rescind the original bond order of 28.6 million and reduce it?
Once we go out to bid for the construction and we have hard numbers on the costs.
Okay, do we have a time frame for that? Is that anytime soon?
I think Bob would know a little better than I do.
We plan on putting that out. To bid. Yeah, we're putting that out to bid in May.
Okay.
So by the end of May, we should have a number for Winona.
Okay, thank you both very much.
You're welcome.
Thank you, Councilor Turco. Councilor Gould.
Unmute yourself. Yep.
Harm in taking the 4 million off of the 28 now. What's the harm in doing that, Michael, please?
Like I said, with all of the paperwork tied up in the SRF funding and with the DEP. They're all working off the $28 million number. And at this point in time, given the circumstances, we're gonna leave that be. And when the real numbers come in, once this project goes out to bid, then we'll come back and do that rescinding.
I'm sorry, I hit my mute button mistakenly. If we don't take the 4 off of the 28, you actually have authorization to spend the 28. Isn't that right, Mike?
Yes, that's technically true, but we wouldn't even come close to, because we still have to borrow the money and go through this SRF funding to actually get the money. So although there's technically approval, there's still a lot of mechanisms to go through to actually get the cash.
Okay.
Is that Councilor Gould?
I'm all set. Thank you.
Thank you, Councilor Gould. Councilor O'Neill.
Thank you, Chairman McGinn. Just a couple questions. I mean, first to start off, I'm still very supportive of this project. When it came before us, I think we had unanimous vote. I just wanted to kind of clarify a couple of things. I don't have a construction background. On the memo that we had, there was a line item for construction contingency showing as 5% in parentheses for a rounded 443,000. Could I just get more color on what that exactly entails?
Yeah, generally we're not sure what's going to be run into when you start digging underground. So there's a contingency for additional costs, and Bob may be able to elaborate on that more.
So the
Mr.
contingencies are,
Lavoisier.
yeah, the contingencies are a requirement that you have to have when you put out these estimates. It's just to cover in case you run into unexpected conditions out there. So DEP wants you to have money set aside to take care of any unforeseen problems.
Okay, thank you. So it's required. It's not something that, okay.
Correct.
And then I guess on the other part of the memo, I wanted to ask, there was commentary that the $2 million that we would in theory be moving over from one part of the project to the other was to cover roadway paving improvements. I just wanted to know, like, why would that paving, amount be so different than what we thought of originally? Just a few months ago.
I'm not sure that the paving number has changed at all. I think it's just a matter of the wording.
It's just the memo we have talks about in order to complete the transmission project, we're requesting an additional bond authorization of $4 million, $2 million to cover the additional cost of the project, another $2 million for roadway paving improvements along the affected areas. I just was wondering if has that number changed? That's the memo we have in our package. I'm just trying to get more color.
I don't know if Mike could answer that.
Well, I don't think that $2 million of paving has changed. It's always been embedded somewhere between the two bond orders.
Okay, maybe it was the memo wording. Lastly, is some of this related to, obviously we have to, reallocate the cost, but does some of this work with the timing due to the probably with the current financial situation, the bond market in general? Is there anything with that, Mr. Generous?
No, this is more housekeeping and paperwork in order to get the projects to proceed. I believe the state already has issued bonds on these at a much larger scale in the hundreds of millions of dollars, and then it would trickle down to us at some point.
Okay, thank you. And like to echo a couple other councilors concerned about the fact that we would have the bond out there. I don't think anyone's going to try to spend the additional funds, but we just want to move quickly to make sure we rescind that original bond to get it down. That's $4 million is a big delta. Thank you.
Other councilors? Councilor Sasslaw. Councilor Sasslaw, Councilor Charis,
Thank you.
and then,
Am I unmuted? Can you hear me?
yes.
Yep, just want to make sure. To the chair, with this 4 million delta, can we put it in the language that it has to come back to us? I know we're looking at May as being the time frame of some sort of knowing what the real cost was. Just for some protection, can we put some language in it that they need to come back to us for a formal vote for the to rescind?
You could make a separate motion.
Separate motion.
Yeah, to do that.
It can't, a point of order, Councilor Charis, it can't be part of this bond order, but you could make a separate motion with that request.
Okay, will you be in favor of doing it yourself, or you would like me to do it?
You're asking me to make the motion, or?
Would you like to make it, or would you like me to make it? Through the chair.
I think it's, if it's your motion, you should make it.
Sure, I will, after your motion. Thank you.
Thank you, Councilor Charis. Other councilors? Councilor Welton.
Thank you, Councilman. Again, through you to Mr. Gingras, I just want to confirm that 4 million is enough so that we're not doing this again prior to the conclusion of the project. Can you just confirm that those numbers are where we need to be at? And I understand that we'll rescind the initial bond afterwards as well, but just want to make sure that we're not doing this again.
No, I agree with you. No, those numbers are firm. We're pretty much ready to roll out with this.
Okay, great. Thank you.
Councilor Sasslaw.
Thank you, Councilor. And just while we had the opportunity to have Bob here, I just was looking for the silver lining maybe here. Bob, with the current situation, with the basically the state order home, everybody staying at home, and talking to the contractor, is this helping with the transmission line on Lowell Street, moving the project along, maybe project along as far as ahead of time, anything like that? I'm just curious, trying to look for a silver lining.
So we have already put out all 3 of those contracts. They've all, the bids have come in. We've been allowed now to award all of them. The pump station, we've already started taking in shop drawings and reviewing materials. Contract number 2, which will be the pipeline from Route 1 down Lowell Street to Route 128. We started taking in shop drawings for that as well. We expect that to start the first week in May. And the pump station, they're just about ready to start ordering some of the makeup. A lot of that is going to be made off-site. It's going to take a while for that to be generated off-site, and they're going to be putting in those orders almost within the next couple of weeks.
So what are they doing from like Sioux Chang's down to say Route 1? I thought that was like maybe one of the main transmission pipelines. Am I confused, or what is that work that's being done?
From Sioux Chang's down to right now, it's the gas company is in there right now. They're replacing their main. So the Commonwealth requires on big projects like this for the gas companies to come in ahead of time and replace any of their gas mains that are more than, and I don't know the exact age, but if they're over a certain age, they have to come in and replace them so that when we're doing the large water main projects, that they won't come across any deteriorated pipe and cause any issues.
So that what they've dug up and they've kind of put back down again, they'll dig up, put the transmission line, and then finally we'll pave it one final time. Is that how that'll work?
That's correct. Yep.
Thank you. Appreciate it.
And just one other quick note. Correct me if I'm wrong, but the authorization for these bonds only allow us to put in the transmission mains and work on the treatment plant. So no matter what, once those bids come in and we have those numbers, we can't spend any more than what we have there. So we can't take any additional money that's left over under the authorization and use that. So I don't, I just wanted you to remember that we just can't use it any way we feel like it. It's approved by SRF and by the council on what we can use that for.
Yeah, that's correct, Bob.
Thank you, Mr. Labassiere. Yeah, Councilor Gould.
Thank you, Mr. Chairman. I really would like to see us approve the 4 million subject to the 28 million being reduced from the other bond if that's possible. And I would look for some guidance on how to make that happen.
I think
Whether we amend the motion or.
Yeah, thank you, Councilor Gould. I think that was the nature of the motion that Councilor Charis was suggesting.
Okay.
I mean, in, you know, given the input that we just got from Director Labassiere, I mean, we certainly can make that motion, but you know, both Director of Finance and the Director of DPS are telling us that they would have no authority to spend that additional money if that's the concern, given the way these are structured. So, you know, if you want to make the motion belts and suspenders, then we can do that. But I don't think they could suspend this in any other manner.
Is that similar to what Councilor Charis wanted to do?
That's precisely what he had suggested. So we can definitely.
It's a separate motion, please.
Yeah, that would be a separate motion. But if that's the will of the council, we can certainly do that.
Okay, thank you.
Mr. Mayor.
Yeah, thank you, Mr. Chairman, Mr. President. I just wanted to weigh in. These have been excellent questions, and I did want to speak, but I think Bob Labassiere covered it well, Councilor Saslaw's question, because right now the work that's ongoing is being performed by National Grid. They're doing their work, which I think with less people on the road, that is allowing that project to move a little quicker, which is good news. There really was two different projects going on. One was running from pretty much Soo Chang's all the way to past the high school. That's ongoing now and moving along pretty quickly. And then the other project that was taking place was over near the South School, kind of going down Brown Street onto Norfolk and then onto Linfield Street over to that intersection. So that work has been ongoing as well. Both those things had to be done before we can begin our work to put in the new transmission lines. So the less cars on the road is helping that project. We gave them authorization to continue to do their work, figuring that would help by having less cars on the road. As to the point about the different numbers, and I didn't understand it at first either. It made sense to me. Well, if we have to pay 4 million more on that project and we're paying 4 million less, then why can't we just do that internally? What we're being led by the state revolving fund, Massachusetts, the Commonwealth of Massachusetts, because we're getting the money from them at a very good interest rate, we have to kind of follow their request. So that's why we have to go and ask for the 4 additional now and then come back to you on the 4. I don't want to step back from the SRF funding that we're getting and maybe complicate the paperwork and slow the project down. So it doesn't really make sense in some ways. It makes sense just to add 4 here, subtract 4 here. But the SRF is advised us that that's what we need to do. So that's why we're bringing it forward in this way. I wish we could have done it in the same format. If the council would like to make a motion to require that, that's fine. But that's the plan is to bring that back, because I want to reduce the 4 million on the other end. But we're being led by the SRF, and I just don't want to mess up that funding opportunity.
Thank you, Mr. Mayor. Other councilors, Councilor O'Neill.
Thank you, Mr. Chairman. I didn't know. I know people, some of the councilors wanted to make a second motion, but unless there are other questions, I'd be fully prepared to make the first motion, which would be to reconfigure this bond order. But I want to make sure that people have had a chance to ask full questions.
I believe I've acknowledged everybody that indicated a desire to speak. I'm going to give us one last scan here. That seems to be the case. Councilor O'Neill.
Thank you, Mr. Chairman. Be it ordered that $4 million is appropriated for the purpose of financing roadway paving and water system improvements, including water transmission main, pump stations, and all costs incidental and related thereto, and without limitation, all costs thereof as defined in Section 1 of Chapter 29C of the General Laws, as most recently amended by statute 1998, chapter 78, that to meet this appropriation, the treasurer, with the approval of the mayor, is authorized to borrow $4 million and issue bonds or notes therefore under chapter 44 of the general laws and/or chapter 29C of the general laws as amended. That such bonds or notes shall be general obligations of the city unless the treasurer, with the approval of the mayor, determines that they should be issued as limited obligations and may be secured by local system revenues as defined in section 1 of chapter 29C as amended. That the treasurer, with the approval of the mayor, is authorized to borrow all or a portion of such amount from the Massachusetts Clean Water Trust established pursuant to chapter 29C as amended, and in connection therewith to enter into a loan agreement and/or a security agreement with the trust, and otherwise to contract with the trust and the Department of Environmental Protection with respect to such loan and for any federal or state aid available for the project or for the financing thereof. That the mayor is authorized to enter into a project regulatory agreement with the Department of Environmental Protection to expend all funds available for the project and to take any other action necessary to carry out the project. And that any premium received upon the sale of any bonds or notes approved by this vote, less any such premium applied to the payment of the costs of issuance of such bonds or notes, may be applied to the payment of costs approved by this vote in accordance with Mass General Law, Chapter 44, Section 20 of the general laws, thereby reducing the amount authorized to be borrowed to pay such costs by a like amount, and that this order be advertised as read. So moved.
Councilors, you've heard the motion. On the motion, just to remind everybody, we've now taken this to the full council, so everybody will be voting. Roll call.
Councilman McGinn, if you could unmute everyone. Councilors Welton,
Yes.
Sasslaw,
Yes.
Mitsoulas,
Yes.
Gould,
Yes.
Charis,
Yes.
Manning Martin. Turco,
Yes.
O'Neill,
Yes.
Elmville,
Yes.
McGinn,
Yes.
Yes.
Rossignol. Motion carries 11-0.
Thank you.
Councilman McGinn, I'll turn it back over to you.
Yeah,
Thank you, Council.
Thank you, Mr. Mayor. Councilor Charis.
Yes, thank you to the chair. To the chairman, I'd like to make a motion that we, at the time of the proposal that comes in approximately May for the reduce of 4 million to come to a vote of the council, just for transparency, since we voted in public for the set amount, that when it's reduction, it's come in front of us again. So moved.
So Councilor Charis, the motion is, I want to make sure I'm getting this right, is to rescind a portion of the bond order approved by the city council. I believe the original date of that was March 28th, 2019, an amount equal to the bond order approved for advertising on April 9th, 2020. Is that correct?
Correct.
Thank you, Councilor Charis. Councilors, you've heard the motion. Roll call.
Counselor,
On the
please, on the
motion.
motion.
On the motion, Councilor Gould.
I had the same intent as Counselor Sharis. Could we make that a co-motion? please?
Absolutely. Co-motion
Yeah,
with Council Gould.
Councilor Gould, I
Thank
think
you.
Councilor Turco was kind of on the same wavelength there. So if you'd like to add your.
And if there's
yourself to
any
that.
other councilors like to also co-motion, I'd be happy for them.
Councilman Melville also has a question.
Councilor Melville.
Yeah, on the motion, Mr. Gingras, is that going to have any issues with what you guys currently have pending with SRF?
If we agree to come back at some point in the future to rescind a portion of that, I don't believe that's a problem. It's just we don't know when it's going to happen and how much. Could be more. Could be more than 4 million.
So,
Sure. So,
just for background, Mike, can you just explain? I think this is something we looked at. This isn't your typical municipal bond. This is going through a state oversight bond for clean water. Can you just clarify that?
That's correct. It's a state bond and a state trust fund. We're going to be allocated a portion of that. They're going to pay as we're building the treatment plant. And once the dollar amount is known for that treatment plant, there were some additional projects embedded for Coolidge, but we would still have enough available funds to reduce the total. But at this point, we need to be in discussion with SRF at some point down the road to do that rescinding. But as far as borrowing the money, we're not going to be able to borrow any more than the project is approved on, like Bob Lavassier indicated earlier. So if that water treatment plant comes in at 15 or 18 or 20 million, that'll be all that we can spend.
I guess my only point on this is I just don't want to complicate what is already a very bureaucratic process with the oversight from the state. That would be, my advice. I totally understand that we're keeping an eye on the money and it's a substantial amount, but this is also very similar to if you were to deal with like the school building authority, where there's a bureaucratic back channel with the state that's seeing a lot of this and auditing it. So I just want to make sure that's clear. I totally get where my fellow councilors are coming from on this, but I think it's just helpful to keep that in the back of your mind. Thanks.
I totally agree with that. I think if the motion is that at some point in the future, in the near future, we agree to come back to the council to rescind part of that bond, and I think that's would be enough to get us back to the council formally and not interfere with the SRF people.
I'm very comfortable with this motion going as is. I'm comfortable with that. I just wanted to weigh in.
Councilor O'Neill.
Thank you, Chairman again. I just want to make sure, it was hard to hear the motion, and just to echo Councilor Melville's comments that, this is a well-controlled project, not only with our own internal departments, but the oversight from the state, not only the financing, but the motion one more time, just so I have it correct, please. Thank you.
The motion was to rescind a portion of original bond order by the Peabody City Council approved on March 28, 2019 in an amount equal to the bond order approved for advertising on April 9th, 2020.
Thank you.
And point of clarification, I think Mr. Gingras kind of indicated that it may not be exactly, so we may want to modify that language to say rescind at least 4 million. Could be more than that.
I wouldn't like to use the word rescind at this point.
What, Mr. Gingras, what do you think a preferred language would be?
That the finance director would come back at some point in the near future to rescind a portion of that bond.
Councilor Charis, are you comfortable with that, with the change? You need to unmute yourself, Councilor Charis.
Yep, absolutely, Councilor. I'm just looking to have it on record that we bond for the exact amount, not that anything over and comes back. I just want to make sure we have it on record exactly what we're bonding for.
Thank you,
So
Councilor
whatever that,
Charis.
yes.
Councilor Gould, it's your co-motion. Are you comfortable with that change?
I am, Mr. Chairman. Thank you.
Thank you, Councilor Gould. Councilor Turco, you're on this motion. Are you comfortable with the change?
I am, sir. Thank you very much, Mr. Chairman.
Thank you, Councilors. Allison, did you capture the change?
Yes.
Thank you. Councilors, you've heard the motion. Roll call.
Could you unmute the microphones, please? Councilors Welton,
Yes.
Sasslaw,
Yes.
Mitsoulas,
Yes.
Gould,
Yes.
Charis,
Yes.
Manning Martin,
Yes.
Turco,
Yes.
O'Neill,
Yes.
Melville,
Yes.
McGinn,
Yes.
Rozignol.
Yes.
Motion carries 11-0.
I continue to relinquish the chair to Councilman McGinn on the
Thank you, Mr.
finance.
Thank you, Mr. President. Item 4B, is communication from His Honor the Mayor regarding a transfer of funds, public safety radio system in an amount of $87,000. Director Gingras.
Thank you. This is a transfer request from Public Safety. They're working on the microwave system. And they've run into a little bit of additional costs with the placement of the structures where they're going to be placing the microwave equipment on. And some of it needs to be shored up, so some additional costs. And this is a request to fund that.
Thank you, Ms. Gingras. Questions from the council? Mayor Bettencourt, did you want to address the council on this?
Councilman McGinn, just as a point of note, the fire chief is here and attendee if you would like to speak with him, as well as Russ Lewis from the fire department.
Yes, thank you, Mr. President, Mr. Chairman. That's what I was going to recommend to hear from Chief Daly and Captain Lewis. Those two have been really running this operation, and they could best explain why we have made this additional request.
Thank you, Mr. Mayor. Chief Daly.
Councilor McGinn, you'll have to go into the attendee list.
Thank you. We got that, Alice.
Oh, can you hear me?
Yes.
Yes.
All right, so the issue we ran into is when they looked at the positioning of the antenna going on the headquarters, it required a new 90-foot tower that the building, the structure could not support. That's antenna has been relocated to 18 Walnut Street, Peabody House. Boston Land Company and Joe McAfee were gracious enough to allow us to use their property. And it was we're at a somewhat of a savings because there was already conduit there to take care of our lines. There was additional cost of $10,000 that we had for consulting that was never budgeted prior. And then $15,000 cost for fiber optics. We were going to try to install in-house, but that wasn't feasible. It's a delicate operation and it requires an outside contractor. Yeah, beyond that, we'll take any questions.
Thank you, Chief Daly. Councilor Turco.
Thank you, Mr. Chairman. Through you to the chief. Chief, you already answered one of my questions, but my other question is, did we look at, I know you can't put it on the firehouse where you wanted to, but have we looked at some of the other locations that we have in Peabody? I thought there was some talk about placing this up on Gedney Drive where the Solomini project is, because we had a utility cabinet up there that could hold the equipment for that. And also, I know that at Wood Trucking, he has the pole up there that has a relatively large location, and I believe that was part of the agreement that fire department could co-locate, fire and police at that location at any time. So I'm wondering, I know you have 18 Walnut, but does it save us any money by co-locating at locations that already exist?
No, it doesn't. There's actually 7 locations. So it's a redundant system. So when some sites go down due to malfunctions or whatnot, but there are 6 additional sites throughout the city. So it is widespread. And like I said, it's a redundant system to make sure we have coverage for police and fire.
Thank you very much, Chief. That's all.
Thank you, Councilor Turco. Councilor Gould.
Thank you, Chief and Captain Lewis. Thank you guys for your help with this. Are we in a lease agreement with the Walnut Street House, the Peabody House rather, or is that a freebie on their part?
Yeah, that is at no cost through Boston Land, and Con has drafted the proper MOU for that. And yeah, they're on Boston Land's in total agreement, and they love to support us.
Councilor Gould.
Thank you for your help with that, Chief Daly and Captain Lewis. Appreciate it.
Thank you, Councilor Gould. Councilor Sasslaw.
Sorry about that. Didn't move my hand. All set.
Thank you. Other councilors? Seeing none, what is the will of the council? We would accept is there a motion from the council to approve transfer from bond premium reserve for projects account number 270-00000-33015 in an amount of $87,000 to the public safety radio system account number 300-00000058924-2019 in an amount of $87,000.
So moved, Mr. Chairman.
Thank you, Councilor Manning Martin. You've heard the motion, councilors. On the motion, hearing none, seeing none, roll call.
Unmute the council.
Councilors Welton,
Yes.
Sasslaw,
Yes.
Mitsoulas. Mitsoulas, yes?
Yes.
Gould,
Yes.
Sheriff,
Yes.
Manning Martin,
Yes.
Turco,
Yes.
O'Neill,
Yes.
Melville,
Yes.
McGinn,
Yes.
Rozignol.
Yes.
Motion carries 11-0.
Mr. Chairman, can you still hear me?
Yes.
Yes.
Could I, with your permission, could I address the council for a minute?
Yes, Chief Daly, go right ahead.
Yeah, I just want to answer some of your concerns. The police and fire department are healthy, and thank you for your concerns. As far as PPE goes, and the DPW, I have given some of the guys, they've asked for some PPE masks, and I have supplied them, and we will keep supplying them in the future. And that's it.
Thank you, Chief.
Thank you, Chief Daly.
Thank you, Chief.
Thank you, Chief.
Be safe.
Thank you.
Thank you, council.
Thank you, Mayor.
Thank you, Mayor.
Mr. President, through you to the clerk. Am I turning this back over to the clerk or to you, Mr. President?
To the clerk, please.
Thank you. I believe I just turned it over to you, so you now have to hand it to.
All right, will do. I can do that. All right, sorry for the delay. Thank you, Councilor McGinn, for those items under finance. Reports of committee being none, we'll move right to motions, orders, and resolutions. Councilor Welton.
Sorry, I apologize for that. Thank you, Councilor. I have no business to report on. I just want to, again, voice my appreciation for everybody in the city who's working so hard to get us through this tough health challenge that we find ourselves in. For the leadership of the mayor, to the hard work of all of our departments, to all of our residents staying positive and working through this. I really appreciate the hard work and very proud to call myself a resident. I know we'll get through all this challenging time. Thank you for the effort to balance it, allowing us to move on and work with the people through this tough time. So, thank you.
Thank you, Councilor Welton. Councilor Sasslaw.
Thank you, Council President. Under special rules, motion receive item 8E and transfer special permit, all papers being in order.
You heard the motion by Councilor Sasslaw. Roll call vote.
Councilors Welton,
Yes.
Sasslaw,
Yes.
Mitsoulas,
Yes.
Gould,
Yes.
Charis,
Yes.
Manning Martin,
Yes.
Turco,
Yes.
O'Neill,
Yes.
Melville, McGinn,
Yes.
Rozignol.
Yes.
Motion carries 11-0.
Councilor Sasslaw.
Yes, under special rules, motion receive item 8F and just acknowledge the road work being done.
You heard the motion by Councilor Sasslaw. Roll call vote.
Councilors Welton,
Yes.
Sasslaw,
Yes.
Mitsoulas,
Yes.
Gould,
Yes.
Charis,
Yes.
Manning Martin,
Yes.
Turco,
Yes.
O'Neill,
Yes.
Melville,
Yes.
McGinn,
Yes.
Rozignol.
Yes.
Motion carries 11-0.
Councilor Sasslaw.
Thank you. And I just want to also just thank everyone for what they're doing. I had a situation yesterday where I did have a resident reach out to me. They had a concern about one of the nursing homes. I immediately got that information. Sharon Cameron, within an hour, she responded. So I want to just thank her and everyone else for what they're doing. And also you, Council President Rozignol. These are trying times. And thank you very much.
Thank you, Councilor Sasslaw. Councilor Mitsoulas.
I have no motion, Mr. Chairman, but I'd like to congratulate you for doing a great job. Thank you.
Thank you very much. I appreciate that. Councilor Gould.
Thank you, Mr. President. I'd like to make a motion to have Department of Public Services install predetermined direction and location signs informing people to where the firefighters and police memorial is on Perkins Street. It's already in the works, but they need a formal motion from us here at the City Council to make that happen. So moved.
You heard the motion by Councilor Gould. Roll call vote.
Councilors Welton,
Yes.
Sasslaw. Sasslaw,
Yes. Yes.
Mitsoulas,
Yes.
Gould,
Yes.
Charis,
Yes.
Manning Martin,
Yes.
Turco,
Yes.
O'Neill,
Yes.
Melville,
Yes.
McGinn,
Yes.
Rozignol.
Yes.
Motion carries 11-0.
Councilor Gould.
Thank you, Mr. President. I'd just like to take a moment to thank everyone for your show of kindness on the passing of my mother. It's tough when you lose your mother, but you guys made me feel better about it, and I appreciate your concern and reaching out to me. Thank you so much.
Again, Councilor Gould, we're sorry for your loss.
Thank you.
Councilor Charest.
Thank you, Council President. I'd like to make a motion on suspension of the rules to move to accept item 8G. So move.
You heard the motion by Councilor Charest. Roll call vote.
Councilors Welton,
Yes.
Sasslaw,
Yes.
Mitsoulas,
Yes.
Gould,
Yes.
Charis,
Yes.
Manning Martin,
Yes.
Turco,
Yes.
O'Neill,
Yes.
Melville,
Yes.
McGinn,
Yes.
Rozignol.
Yes.
Motion carries 11-0.
Councilor Charest.
Yes, I'd like to make a motion to ask DPW to install a neighborhood watch sign on the entrance in Buttonwood and Violet Ave. So move.
You heard the motion by Councilor Charest. Roll call vote.
Councilors Welton,
Yes.
Sasslaw,
Yes.
Mitsoulas,
Yes.
Gould,
Yes.
Charis,
Yes.
Manning Martin,
Yes.
Turco,
Yes.
O'Neill,
Yes.
Melville,
Yes.
McGinn,
Yes.
Rozignol.
Yes.
Motion carries 11-0.
Councilor Charest.
And I just want to end my motions to say, as much as it's been very productive, I look forward to be able to sit next to all my counselors in a regular setting. And I just want to thank
Yes.
Council President Tom Rosenthal for leading us through this troubled times. It was a big job that you had to do, along with Allison, who's, again, have no honeymoon time to get settled, get thrown right in it. But you two leaders is making this process a lot easier and smoother. And I do appreciate everything you're doing, as well as my fellow counselors, and hope their families and themselves stay safe. And I look forward to sitting next to you in the chairs. Thank you.
Thank you,
Mr.
Councilor Charest.
President, sorry, Mr.
Councilor
President.
Gould.
Through you to Allison, could I amend my motion on Perkins Street Police and Firefighter Memorial to make that a co-motion with Councilor Charest, please? I was
Appreciate that.
negligent in doing that.
Thank you, Council Gould.
Thank you. Thank you.
Councilor Manning Martin.
Thank you, Mr. Chairman. Can you hear me?
Yes.
Great. Yeah, I want to commend the City Council President and our clerk well for the methodical and cautious manner that you've rolled this process, this virtual process out in order that we can continue to conduct the people's business. So I know that a lot of work went behind that. So I wanted to thank you both for the patience and organization that you've put behind this. So you've done great work. So I thank you very much. I would like to make a motion to request community development to update the council on our affordable housing stock and its percentages with 40B. I'd like that data to include the status of all active, pending, and proposed 40B applications and their effect on our current and projected affordable housing stock. Again, with respect to 40B applications. So moved.
You heard the motion by Councilor Manning Martin. Roll call vote.
Councilors Welton,
Yes.
Sasslaw,
Yes.
Mitsoulas,
Yes.
Gould,
Yes.
Charis,
Yes.
Manning Martin,
Yes.
Turco,
Yes.
O'Neill,
Yes.
Melville,
Yes.
McGinn,
Yes.
Rozignol.
Yes.
Motion carries 11-0.
Councilor Manning Martin.
Thank you, Mr. Chairman. No further motions.
Thank you. Councilor Turco.
Thank you, Mr. President. Move to receive item 8C under suspension of the rules.
You heard the motion by Councilor Turco. Roll call vote.
Councilors Welton,
Yes.
Sasslaw,
Yes.
Mitsoulas,
Yes.
Gould,
Yes.
Charis,
Yes.
Manning Martin,
Yes.
Turco,
Yes.
O'Neill,
Yes.
Melville,
Yes.
McGinn,
Yes.
Rozignol.
Yes.
Motion carries 11-0.
Thank you, Mr. President. Move to receive and approve all papers being in order. Item 9A, under suspension of the rules, taxi cab license Sean Howell, license 59.
You heard the motion by Councilor Turco. Roll call vote.
Councilors Welton,
Yes.
Sasslaw,
Yes.
Mitsoulas,
Yes.
Gould,
Yes.
Charis,
Yes.
Manning Martin,
Yes.
Turco,
Yes.
O'Neill,
Yes.
Melville,
Yes.
McGinn,
Yes.
Rozignol.
Yes.
Motion carries 11-0.
Councilor Turco.
Mr. President, move to adopt as advertised, item 10A, under suspension of the rules.
You heard the motion by Councilor Turco. Roll call vote.
Councilors Welton,
Yes.
Sasslaw,
Yes.
Mitsoulas,
Yes.
Gould,
Yes.
Charis,
Yes.
Manning Martin,
Yes.
Turco,
Yes.
O'Neill,
Yes.
Melville,
Yes.
McGinn,
Yes.
Rozignol.
Yes.
Motion carries 11-0.
Councilor Turco.
Mr. President, move to adopt as advertised, item 10B, under suspension of the rules.
You heard the motion. Roll call vote.
Councilors Welton,
Yes.
Sasslaw,
Yes.
Mitsoulas,
Yes.
Gould,
Yes.
Charis,
Yes.
Manning Martin,
Yes.
Turco,
Yes.
O'Neill,
Yes.
Melville,
Yes.
McGinn,
Yes.
Rozignol.
Yes.
Motion carries 11-0.
Councilor Turco.
Mr. President, I also wanted to say to you, thank you very, very, very much for the work that you put into this. I know I can speak for myself personally. I'm sure each of us have spoken to you almost on a daily basis. I'd say that I spoke to you more than with my wife, but I'm actually sequestered with her 24 hours a day. So I haven't, normally it would be you, but it's her this time. But thank you, Allison, and also we haven't missed a beat at City Hall, and thank you very much for everything.
You're welcome. Thank you.
Thank you. Councilor O'Neill.
Thank you, Mr. President. Under suspension of rules, move to accept item 8B and refer that matter to Legal Affairs Committee. So moved.
You heard the motion by Councilor O'Neill. Roll call vote.
Councilors Welton,
Yes.
Sasslaw,
Yes.
Mitsoulas,
Yes.
Gould,
Yes.
Charis,
Yes.
Manning Martin. Yes. Turco,
Yes.
O'Neill,
Yes.
Melville,
Yes.
McGinn,
Yes.
Rossignol.
Yes.
Motion carries 11-0.
Council O'Neill.
Thank you, Mr. President. Under suspension of rules, move to accept item 8D and refer that matter to the special permit hearing that's been postponed. So moved.
Heard the motion by Council O'Neill. Roll call vote.
Councilors Welton,
Yes.
Sasslaw,
Yes.
Mitsoulas,
Yes.
Gould,
Yes.
Charis,
Yes.
Manning Martin,
Yes.
Turco,
Yes.
O'Neill,
Yes.
Melville,
Yes.
McGinn,
Yes.
Rossignol.
Yes.
Motion carries 11-0.
Council O'Neill.
Thank you, Mr. President. And lastly, I can't not echo the comments from everyone. Thank you for setting this up, all the behind the work, Allison, all the technology stuff, getting us ready to do this and continue with the people's business. Thank you very much for doing this. Appreciate it. Thanks.
Thank you very much. Council Melville.
Thank you very much, Mr. President. Going down the list, am I missing? Is minutes accepted that we haven't done something yet?
7 and 8A are the only two items left on the agenda that have not been moved.
All right. And suspension move receive item. You said 8A.
Correct.
All right. Move to receive item 8A. So moved.
Just to accept.
Motion to accept item 8A.
You heard the motion by Council Melville. On the motion, roll call.
Council Welton,
Yes.
Sasslaw,
Yes.
Mitsoulas,
Yes.
Gould,
Yes.
Charis,
Yes.
Manning Martin,
Yes.
Turco,
Yes.
O'Neill,
Yes.
Melville,
Yes.
McGinn,
Yes.
Rossignol.
Yes.
Motion carries 11-0.
Council Melville.
All right, thank you very much, Mr. President. Real quick, I just want to say thank you to everybody again. There's some really good information for the public on the website, the city's website. Broken down quite a bit of information. That it uses a reference point. But I want to thank you, Mr. President, Allison, all the crew, all my fellow councilors. This is we're adapting to difficult times. You've done a great job. So thank you.
Thank you very much. Council McGinn.
Thank you, Mr. President. Under suspension of the rules, move to receive item 7A and refer to finance. So moved.
You heard the motion by Council McGinn. Roll call vote.
Councilors Welton,
Yes.
Sasslaw,
Yes.
Mitsoulas,
Yes.
Gould,
Yes.
Charis,
Yes.
Manning Martin,
Yes.
Turco,
Yes.
O'Neill,
Yes.
Melville,
Yes.
McGinn,
Yes.
Rossignol.
Yes.
Motion carries 11-0.
Council McGinn.
Thank you, Mr. President. I would also add my words of thanks to you for your leadership at this time and all the work that the city clerk is doing behind the scenes to help enable this process. So thank you to you both.
Thank you very much. All right, last but not least is me. First of all, I got to thank each and every one of you. This has been a daunting process, both personally, professionally, emotionally. So thank you for all of your hard work during these trying times. Stay safe with your families. This process would not have been even remotely as successful without Allison Danforth, the city clerk. She, over the last 3 weeks, has really taken the bull by the horns and established a great timeline and a great way of conducting the city's business. So a great deal of thanks and admiration goes to her. I know this process was long. I know this process was a little bit more difficult than what we're accustomed to. What we'll try to do is maybe put a few fewer items on the agenda so that it's not so daunting, knowing that every motion is going to have to be a roll call vote. Everybody has to actually speak in order for the roll call to be proper. But I appreciate your time, your patience, and your understanding throughout this whole process. I really appreciate each and every one of you as individuals and as a council. I think, and I say this to anybody that asks, I honestly think that we might all come from different backgrounds and we might not all attack a topic the same way, but I honestly think that each and every one of us has the city's best interest at heart. And that, I think, has shown throughout this whole process. With all of that said, I would entertain a motion to adjourn.
Move to adjourn.
So moved.
So move.
You heard that from Council McGinn. Unfortunately, we have to have a roll call vote. One last time, Councilor Welton.
Yes.
I'll start it off.
Safla,
Yes.
Mitsoulas,
Yes.
Gould,
Yes.
Charis,
Yes.
Manny Martin,
Yes.
Turco,
Yes.
O'Neill,
Yes.
Melville,
Yes.
McGinn,
Yes.
Rozignol.
Yes.
Motion carries 11-0.
Thank you very much, everyone. Have a great night.
Good night, everybody.
Bye now.
Thank you.
Good night, everybody.